Hello, hi, thank you for joining me. This is Dr. Erica, pharmacist for close to 10 years. Thank you for joining me for this particular video chat. This is part 2 of the MPJE law exam practice, and I'm going to go over some questions that are typical for the examination. The real exam, again, is going to be a 75 question exam and 120 minutes, if I'm not mistaken, and also, the exam is covered federal law as well as state-specific law. So do know your state law questioning and answering very well, because the correct answer is generally going to gear towards the law of the state, not so much the federal law, but it's good always to know federal law versus the state law. So for this particular video, I'm going to talk about the questions itself. So I have a book, uh, an MPJE study guide book, and I have a reference in the description. So do take a look at that. Now these questions, I'm going to go over just a few questions just to give you an idea of what the exam is going to look like or sound like. And some of the wording may be tricky, so do understand that you need to know the law through and through, backwards and forwards. Okay, know the statutes, know the laws that the standards that are the foundation for the laws. Know all of those. Know as well not only current information, but know what red flags are, what prescription drugs are, what labels should look like, prescription should look like, what information from the physician should be on there, and so forth. Things of that knowledge and skill of what you're going to be using, okay? So the first question, okay, within what time frame of 2 documented attempts of detoxification can an 18-year-old become eligible for narcotic maintenance treatment? Okay, A, 1 month, B, 3 months, C, 6 months, or D, 12 months, and then E, 18 months. The correct answer is going to be 12 months. So a patient of 18 years of age and older have to have 2 consecutive uh, documented attempts of detoxification failures, 12 months, in order to be eligible to be placed in an official maintenance treatment program. Okay. Number 2, which act or amendment granted the FDA the authority to inspect factories? Again, that goes back to the standards and the foundations as to how these laws came into existence. So we need to know the foundational acts and statutes. Okay, the act or amendment granted the FDA to the authority, to inspect factories. Is that A, Pure Food and Drug Act, B, Food, Drug, and Cosmetic Act, C, Durham and Humphrey, D, Food, Drug, and Inspection Administration, or E, FDA? So the correct answer is Food, Drug, and Cosmetic Act. Okay, the Food, Drug Administration Safety and Innovative Act improved the FDA's inspection authority. Okay, so the third question is, which of the following acts or amendments was the first to regulate the transportation of adulterated or misbranded drugs in interstate commerce? A, Pure Food and Drug Act. B, Food, Drug, and Cosmetic Act. C, Food, Drug, and Insecticide Administration. D, Drug Abuse Control. Or E, Drug Importation Act. So which of the following acts or amendments was the first to regulate the transportation of misbranded or adulterated drugs in interstate commerce? And that's going to be Food and Drug Act. A, regulated false advertising, proper label, ingredient content, all of that had to be in place, and that was regulated by the Pure Food and Drug Act. Number 4, which of the following must be ordered using a DEA Form 222? Okay, so the 222 form, as we know, is a ordering form for controlled scheduled drugs C through 5. Okay, so which of the following must be ordered using a DEA Form 222? 1. Secobarbital suppository. 2. Pentobarbital injection. 3. Amobarbital capsule. The correct answer is going to be 2 and 3. Okay. Now these are ordered using DEA Form 222, the pentobarbital injection and the amobarbital capsule. Okay, so that goes back to knowing your C1, C2, C3, C4, and C5 medications. Okay, so we know C1, we don't order those in pharmacy. They're not allowed to be prescribed, C1 class. So C2 class are the only ones through 5 that are allowed to be ordered using the 222 DEA form. Okay, so question number 5. Which of the following items must be ordered for a wholesaler on DEA order form 222? Which of the following items must be ordered from a wholesaler on the 222 form? Okay, is that 1, morphine sulfate extended release. 2, meperidine injection. 3, diazepam tablet 5 milligrams. The correct answer is 1 and 2, because we know that these are Schedule 2 medications. Okay, and diazepam is a Schedule 4 medication. So the DEA 222 form is a controlled medication form for ordering C2s alone. Okay, so good to know. It's good to know for the exam which medication falls into which control category. So number 6, which of the following products is classified as Schedule 3 controlled substance? Which of the following products is classified as Schedule 3 controlled substance? A product containing 90 milligrams of codeine per dose, a product containing 15 milligrams of hydrocodone per dose, or a product containing 2.5 milligrams of diphenoxylate and 25 micrograms of atropine sulfate. The correct answer is 1, a product containing codeine per dose. So the question again is, which of the following products is classified as a Schedule 3 control? So that question is asking particularly for Schedule Control 3. Okay, we know number 2 is hydrocodone, that's a Schedule 2. And again, atropine and diphenoxylate are Schedule 4. Okay, so it's good to know. Okay, number 7, which of the following, all of the following would be considered as incidents of misbranding, except the active drug is not identified on the label. So let me read that again. All of the following would be considered as incidents of misbranding. Misbranding refers to the label. Misbranding refers to the label. The label is actually reading something that is not true, or the label is reading something that is obscured. So misbranding refers to the label itself. So the question says, all the following will be considered as incidents of misbranding except A, the active drug is not identified on the label. B, the original bottle of 40 contains only 35. C, the names of inactive ingredients are not on the label. Okay, that's a red flag. All 3 of A, B, C are red flags. D, the level of the drug in the product is 10% volume per volume, but the label states 15% volume per volume. So, okay, and then E reads, the pharmacist dispenses a drug without the prescription. Okay, so all the following would be considered as incidents of misbranding except D. The level of the drug in the product is 10% volume per volume, but the label states 15% volume per volume. Okay, that's a tricky one. Misbranding, again, refers to the label itself, accuracy, ingredients, all of those inactive ingredients, active ingredients, any missing information, all of that is considered as misbranding. Okay, so everything has to be precise. Now, the measurement for D, the level of the drug in the product, is off, but this is considered to be an exception to misbranding. Okay, so read upon that. Okay. Number 8, partial filling of which of the following prescriptions of controlled substances may be granted upon request of the patient. Okay, let me read that again. Partial filling of which of the following prescriptions of controlled substances may be granted upon request of the patient. 1, Valium, 2, Concerta, or 3, Alfenta. The correct answer is 1. Okay, partial filling of Valium, which is a Schedule 4 drug, can only be granted. C2s are not granted for partial filling by request of the patient. However, that can be overridden by with the pharmacist and the prescriber. Going to be C4, C5, or C3. Okay. Number 9, the formulary of a pharmacy providing services under MMA may be limited to which of the following? The formulary of a pharmacy providing services under MMA may be limited to which of the following? A, the top 200 drugs, B, generic drugs, C, at least one drug from each of all therapeutic categories developed by the USP, D, top 100 drugs, or E, single source drugs. The formulary, this is a difficult question. The formulary of a pharmacy providing services under MMA may be limited to which of the following? The correct answer is at least one drug from each of all therapeutic categories developed by the USP. Okay, number 10, which portion of the following federal counseling regulations are a requirement for each individual state? 1, prospective review, B, meta-analysis review, 3, retrospective review. Which portion of the following federal counseling regulations are a requirement for each? And that's going to be 3, retrospective review. Okay, I'll read a couple more questions. When a controlled substance inventory is conducted, which of the following must be included? 1, drugs returned by a customer. 2, drugs ordered by a customer but not yet paid for. All controlled substances dispensed over the past month. Okay, no. So the correct answer is going to be all drugs that are in the pharmacy at the time of the inventory will be counted, whether it is just waiting to be picked up in will call or it is on the shelf as bulk inventory. All those must be counted. The only thing that's not counted are the things that have been picked up recently. We don't count what's been sold because it's no longer part of the inventory of the pharmacy. Okay, so number 12, an individual is eligible for Medicare plan D enrollment on May 8th, 2012. An individual is eligible for Medicare plan D enrollment on May 8th, 2012. Which of the following is the exact period he can enroll in the Part D plan without a penalty? Okay, A, February 1st to August 31st. B, May 1st to May 31st. C, May 1st to August 31st. D, January 1st to December 1st. Or E, May 8th to November 31st. So an individual is eligible for Medicare Plan D enrollment on May 8th. So that patient, which of the following exact period he can enroll in part? So he has 3 months ahead, March, April, May. And then he has another 3 months following May 8th. So the correct span of time is going to be A, February 1st to August 31st. So he's given 6 months surrounding, a total of 6 months surrounding that eligible date. Okay. 3 months before and then 3 months behind. All righty. Drug products of the same strength and same dosage form may be interchangeable if they are in which of the following classes? Select all that apply. A, B, B, C, B, D, BS, or E, AB. Now, a product is, according to the Orange Book, a product is considered interchangeable if it is A rated or B rated. Okay, so AA is definitely interchangeable. They have the same strength, same effectiveness, same safety profile, same dosage form, and so forth. Okay, and then B is going to be also the same. So the correct answer is going to be for letter A and letter C, which is going to be A rated and B rated products. AB products are not rated the same. They are a little bit different, but they're not the same as far as interchangeably being dispensed. Okay, check your Orange Book. Understand what the Orange Book is telling us. Also, the Orange Book is online as well, and you can find out more information as far as ratings. Okay, if the following DEA number is authentic, MS242651, MS242651. Which of the following is true about the letter S and the last missing digit? Okay, so we know the DEA number is a number that is assigned to each prescriber or practitioner who's writing prescriptions. And so the 7-digit number is a sequence of numbers, and then the second letter is the initial of the physician or practitioner. So S is going to be the first letter of the practitioner's last name. And the missing number in the 7-digit sequence is going to be number 1. So the correct answer is going to be the first letter A. Okay, so DEA number. Do understand how to come up with the first and second letter for practitioners. The second letter is always going to be the prescriber's first letter of the last name. And then the 7-digit number is always going to be a total that should be a number that equals, let's see, it's 4, it's 9. Yep. So the DEA number, let's look at that. And this is federal information as far as the DEA number for a practitioner. Okay, so the DEA number, the last number, the 7-digit number, the last number should be a check digit. That's correct. Be sure to understand the formula because it's going to be tested on the exam. Even though it's not used in practice much, it's still a valuable tool. If a pharmacist suspects fraudulent activities, they can always use the DEA number that is on the prescription, and that last number is going to be the check digit. Okay, so for example, take the following. The numbers are randomly generated, and the final check digit is the number one. The formula is as follows. Odd positions should come up with the number, and then the even position should come up with the number. Then when you add the odd answer and the even answer together, that last number in that set of double digits should be your check number, okay? And that is called DEA registration for practitioners, and it's used to catch all of those suspected prescriptions that may come through. The DEA number will help decipher that. Now, our following is true of Pure Food and Drug Act. Select all. Okay, this law was passed because of the mistaken use of the ethylene glycol that led to death. Okay, not true. The law prohibits the commerce of foods, drugs, and cosmetics to be adulterated or misbranded. Not true. Okay, we don't permit, or the law prohibits the commerce of food and drug products to be adulterated. Okay, no, that's not true as well. Okay, the law was passed by the Congress in 1938. Okay, that's not true. Okay, then D says the law failed to protect the public. Okay. Okay, that is, okay, the law failed to protect the public. Okay, the law, E says the law was passed by the Congress in 1906. Okay, and that is true. Okay, so which of the, again, the question read, which one of the following is not true about Pure Food and Drug Act? This law was passed by Congress in 1938. Okay, that's questionable. Let's see what the correct answer tells us. Okay, so the correct answer is A, B, and C. The law was passed by the Congress in 1938. That's not true as well. Okay, so the next question is, which drug is correctly assigned to its schedule? A, Schedule 3, 1.5 grams of codeine per 100 milliliters. B, Schedule 3, 350 milligram of ethyl morphine. No, morphine is more of a Schedule 1 and Schedule 2, sounds like. Ethyl morphine. C, Schedule 4, 300 milligram of ethyl morphine per 100 milliliters. Schedule 4, no. That's not correct. D, Schedule 4, 150 milligram of dihydrocodeine per 100 mil. That's a Schedule 2, if not mistaken, or Schedule 1. E, Schedule 3, 350 milligram of dihydrocodeine per 100 mils. Okay, that's not Schedule 3. Okay, so the correct answer is A, codeine. Codeine is Schedule 3. 17, health professionals self-prescribing is acceptable. In most states, health professionals self-prescribing is acceptable in A, most states. B, it is not acceptable at all. Number 3, in most states and nationwide. D, nationwide, and it is not acceptable at all. And then E, all of the above. Okay, health professionals self-prescribing is acceptable in most states. Okay, I'll read one more. Examples of drugs that can be exempted from child-resistant packaging requirements. Examples of drugs that can be exempted from child-resistant packaging requirements. A, no drugs are exempted. B, aspirin effervescent tablets containing 15% of the drug. C, no drugs are exempted. Acetaminophen effervescent tablets with 20% of the drug. D, acetaminophen and aspirin. Or E, all of the above. So the correct answer is aspirin effervescent tablets. Okay. Number 19, a pharmacy. These questions are addictive. I'll do one more and we'll end there. A pharmacy should limit interstate distribution of compounding prescription products to not more than A, 2% of the total prescription filled by the pharmacy, B, 5%, C, 10%, D, 15%, or E, 20%. So the question reads, a pharmacy should limit interstate distribution of compounding prescription products to not more than 5% of the total prescription filled by the pharmacy. So the correct answer is B. Okay, so that question reads that a pharmacy should limit its road delivery of compounding prescription products to not more than 5% of the total prescriptions filled by the pharmacy. Under which of the following conditions may practitioners of traditional Chinese medicine sell ephedra containing products? A, the level of ephedra is less than 2 milligrams per dose. B, only a 5-day supply of the product is sold. C, the label does not indicate that the product is a dietary supplement. D, a prescription is issued for the product. And E, sales are illegal. So let me read that again. Under which of the following conditions may practitioners of traditional Chinese medicine sell ephedra containing products? The answer is C. The label does not indicate that the product is a dietary supplement. Okay, so I've gone over 20 of these particular question example tests. So do check out the book itself and let me know what you think. I just wanted to give everyone a a gist of what the questions for the law exam are about. You know, they're about concentration, they're about laws and original foundations that come up with the laws, concentrations and max quantities to be counted and inventoried and shipped, and about pharmacy and things of that sort. So do know your numbers, do know calculations as well, your scheduling, schedules, control schedule 1 through 5. Do know which medications fall under those categories. Do know AB rating as far as Orange Book is concerned. Also know true and false of each statute, such as the Pure Food and Drug Act. Do know the true and false of all of those. DEA, Food, Drug, and Cosmetic Act. Do understand how those came into origination, and also you want to know about the DEA forms 222 and 224. Know the differences between all of those 22 forms as well. Know about also Medicare plans and enrollment, regulations surrounding federal counseling, and also a patient request, whether it could be granted or denied, or a practitioner must step in to do that bidding. So do understand those types of questions, okay? And I wish everyone the best in their studies. And I'm Dr. Erica. I'm going to sign off. Thank you for joining me. Take care. Bye-bye.